My name is Anna Wheatley. I'm the Senior Commissioning Manager for NHS Coventry and Rugby Clinical Commissioning Group and NHS Warwickshire North Clinical Commissioning Group. In 2017, our CCGs were awarded 2 years NHS England transformation funding to support increased uptake of structured diabetes education and achievement of 3 NICE treatment targets: blood pressure, blood glucose and blood cholesterol. We developed a sustainability and transformation partnership across Coventry and Warwickshire and called this the Diabetes Strategy Group. The purpose of this group was to identify specific diabetes service requirements and to drive a strategic review of the whole diabetes pathway. Through an innovative approach to working with key stakeholders, these were our local authority, our health services, our community leaders, Diabetes UK, and community voluntary and outreach services, we identified novel approaches to introducing key diabetes messages delivered outside of a traditional healthcare setting to support improvements in diabetes care. From this work, we developed a new post, our Diabetes Community Champion, to support our community outreach. This role supports our Diabetes Champion volunteers who are embedded within our communities and would act as our conduits for information sharing. The strategy group focused on a targeted approach to defined groups across Coventry and Warwickshire who are recognised as least likely to attend face-to-face structured education for diabetes. Our initial priorities were our seldom heard and Black, Asian and minority ethnic communities. Our champion, Suman Gaywal, has made a hugely significant impact on our ability to go into our communities and deliver bespoke educational events and information sharing. Through community champions trained by Diabetes UK and clinical support from myself and our diabetes teams, Suman has identified and recruited our community champion volunteers and supported them by providing them with appropriate training, knowledge and skills. Suman and myself have developed, implemented and delivered a programme of events over the past 18 months. Going forwards, we will continue to engage and build community partnerships with seldom heard groups and BAME communities, Eastern European and Black African Caribbean communities. We strive to continue to expand and reach out to our wider communities across the whole of Coventry and Warwickshire. From the work undertaken by our champions, we have shown the value of connecting to our communities in this way, and that this diabetes model can be replicated within other long-term health conditions, addressing health inequalities and supporting provision of population health messages. One of our diabetes champion volunteers, Karan Barrage, is our champion star, showing the enthusiasm and commitment to his community by supporting key diabetes messages and sharing information. He is flourishing in his role.
My name is Karan Barrage. I am immediate past president of Coventry Mercy Lions Club. I am also voluntary diabetic champion with NHS Coventry and Rugby CCG, and also I'm a qualified diabetes champion with Diabetes UK. I decided to become a diabetes champion with NHS Coventry and Rugby CCG because I wanted to learn more about diabetes and gain insight into diabetes so that I can reach out to the community and use this knowledge to raise awareness of diabetes, awareness of how to control, prevent and manage diabetes. The champions training benefited the local community in Coventry immensely. First of all, we were able to raise awareness about diabetes, control and prevention. We had a link with Suman Gaywal at NHS Coventry and Rugby CCG, who with her team joined us in arranging a very large event at one of the local Sikh temples. Suman Gaywal brought her team for blood testing and also health and well-being team. On the day, they did blood tests. I think they did about 200 blood tests. Uh, and the HbA1c blood test is actually one of the best blood tests. It gives a reflection of the sugar level in the body in the last 3 months. There were a number of people who were identified with high diabetes sugar level, which they did not know, and they were referred to their GPs. In essence, the community benefited because by doing these tests, there were a number of lives that have been saved. Uh, on that day, we also had stalls. Suman Galiwal had brought her team with the stalls giving out information about healthy eating and well-being, and they did blood pressure tests as well. So the community did benefit considerably by learning about diabetes. In fact, we were asked to do the same diabetes event again this year. It's very important because the diabetes champions have been given training. They have been given insight into diabetes. They have been empowered with the knowledge about diabetes, and they have been trained about the complications of diabetes. Now, a lot of people who have been diagnosed with diabetes, they seem to be under the impression, but it's just controlled by tablets alone. Uh, However, they need to be aware that if they do not manage it themselves, there are very long-term horrendous complications of diabetes. Diabetes is the only disease that affects every organ in the body. We are still going to continue with the NHS Coventry and Rugby CCG because there were two events, and the two events were highly successful. We have only touched a very small segment of Asian, Caribbean, and Muslim and Chinese communities. There's still a lot of work to be done, and and building on the success of these two highly successful events, we will continue giving this service to the community. I am now a multi-district diabetes officer, which means I am covering whole of United Kingdom, uh, uh, and I will be using the Coventry, not NHS Coventry and Rugby CCG as a model to do presentations to show how using the services of this local NHS Coventry and Rugby CCG, we were able to do successful events to raise awareness.